When Molly picked up her regular generic prescription for Vyvanse back in May, she didn't really think that much of the fact that the pills looked a little bit different than usual. But over the next 2 weeks, she ended up fighting bouts of severe depression. She had so little energy that she couldn't get up to clean her house, and she thought really hard. She was like, work is not that different than usual. I don't know what's going on. Finally, she thought maybe it was the medication. She looked at her medicine cabinet and she found an old pill from a previous prescription that was a little bit different than the one she was taking now. And she took it and she felt a night and day difference. She was able to get up and do things that day and felt a million times better. I'm Emma. I'm a senior health journalist at medshadow.org. And a little while back, I posted an article about generic ADHD meds having varying quality. And a lot of you asked me to look into Vyvanse specifically. So here it is. We just posted this article on medshadow.org. Found Molly is definitely not alone. This is Ryan Sultan. He is an ADHD expert psychiatrist who works in New York. He said that up to 70% of his patients, he's had to increase their doses of Vyvanse after they switched from brand name to generic or from one generic to another. He also said that because the potency of Vyvanse, it's a little bit more potent than the other ADHD meds, people that struggle with it tend to be more prone to this type of emotional dysregulation. Since generic Vyvanse was approved back in 2023, there are 14 different manufacturers making it. Two of them have, at one point or another, been recalled. The first one is Lanet. That recall is over. It ended in June 2025. The company didn't release a public statement, but the FDA database says that they failed content uniformity, which meant that some of the 10 milligram pills didn't actually have 10 milligrams in them. The second one is Sun Pharmaceuticals. It started earlier this year. Again, they didn't issue a press release, but what we know from the FDA records is that the 60 milligram dose failed a long-term stability test. That meant that after it had been in storage for a while, it was no longer dissolving at the rate that it was supposed to, meaning that somebody who took it could get an inconsistent dose. If you think that your medication may not be working the way it normally does, make sure that you keep records of what you're experiencing and then report to the MedWatch database. Over time, the FDA monitors this database and they can investigate drugs that don't seem to be working the way that they are supposed to be. You can also ask your doctor to write dispense as written on your prescription. Sometimes they'll do it. Sometimes insurance will cover it. You might have to fight with them. They might not cover it enough. That tends to be the case. If that's the case, then you might try a different generic version or ask your doctor to increase the dose slightly. That's what Dr. Sultan usually does for his patients, and he says it usually helps. Here at MedShadow, we're doing a series investigating the manufacturing problems we sometimes see, particularly with generic drugs, but not exclusively. If there's a medication you want us to look into, let us know.